Hello, I'm Alfredo Ruggeri from Resono Ophthalmic, and I would like to present the study done at the dry eye service at Konstantopouleio Hospital in Athens on the therapy with the Rexon-Eye device in mixed-type dry eye patients. Dry eye is a very complex disease. It may range from mild discomfort up to very severe corneal disorders, and the number of patients is very high. It has been recently shown that its prevalence and incidence are even increasing for all ages. Various therapeutic options are, of course, available, but most of them address only the alleviation of symptoms at short or mid-term. The approach we adopted with the Rexon-Eye device is different because it addresses the real cause of the disease. The therapy is based on the delivery of a low-power, high-frequency electrical current applied to patients via the mask electrodes they wear on their closed eyes. This current is able to stimulate the natural regeneration of tissues and cells via an effect we call QMR, quantum molecular resonance. The treatment has been shown to be effective in all types of dry eye, both evaporative as well as aqueous deficient, as reported in these papers, and to allow for long-lasting remission of symptoms. It is very simple to administer, not invasive, it is actually pleasant, and with no side effect evidenced in treated patients. The QMR effect was actually discovered in the 80s in order to obtain a surgical cut without using heat. It was discovered that an electrical current at very specific frequencies, 4 MHz and harmonics, was able to maximize the transfer of energy to tissue and to obtain the cut without wasting energy into heat. For this reason, the cut is non-traumatic with temperatures always below 50 degrees and allows for several important benefits from a medical point of view. Later on, the same QMR effect was shown to be able to stimulate the natural regeneration of cells and tissues. This may be explained by the result obtained in a study on human mesenchymal cells using a DNA microarray analysis. It revealed transcriptional changes on the treated cells and, in particular, the upregulation of genes involved in extracellular matrix remodeling, embryogenesis, and wound healing. And if you're interested, you can find a report of the study in this recently published paper. The regeneration capabilities offered by Rexon-Eye were applied by the colleagues at Konstantopouleio Hospital in Athens to treat moderate to severe dry eye patients. They designed a study and recruited 18 such patients, and in this presentation we give a brief account of the results. Details of the protocol and exclusion criteria are summarized here. The Rexon-Eye treatment protocol involves 4 sessions, 1 per week, and in each session the patient has just to sit for 20 minutes wearing the mask electrodes. Values of the applied electrical parameters, reported here, were such that the total delivered power was between 10 and 12 watts. Patient evaluation was performed before and 1 month after the treatment by measuring several parameters described in the patient's conditions as regards tears and eye surface. In these tables, values for all parameters are reported before and after the treatment. And we can see that with regard to inflammation, 8 patients moved from positive to negative. Meibomian glands quality was also greatly improved. The numerosity of toothpaste grading decreased from 24 eyes to only 2, and clear increased from 0 to 16. All other parameters also improved. Tear meniscus normalization further supports the marked reduction of inflammation highlighted by the MMP9 and corneal staining results. The meibomian glands not only improved in their functionalities, as seen above, but also in their number. All this resulted in a markedly increased tear breakup time and decreased OSDI score. So we have seen that the QMR treatment delivered by the Rexon-Eye device was able to induce a significant improvement in all the measured parameters despite the complex and severe type of dry eye that affected these patients. In particular, parameters related to inflammation were greatly improved in most of the patients, as well as the subjective OSDI score. In addition, many of these patients were treated from several months up to more than 1 year ago, and they all maintained these benefits in the period without exhibiting any adverse event. In conclusion, this study confirmed that the treatment with the Rexon-Eye device is actually an integrated therapy for the whole lacrimal functional unit in all types of dry eye patients. On behalf of all the authors, many thanks indeed for your attention, and feel free to write us for more information about this study.